Okay.
Amitabh ji, this is another Amitabh, just putting a question to you. You know, we've been talking about nutrition on the show, and you recently launched Poshan Gyan, which is a digital repository on information about nutrition. So how are you hoping this will bring about behavioral change on the ground? And the other point is that earlier on I was trying to put across to you, aspirational villages is a topic that perhaps you're quite conversant with.
You were saying.
And the other was rice fortification. What exactly do you mean by that, and what does it mean in today's times?
Right.
So thank you. Let me first start with aspirational district program. This covers 112 of our most backward districts. These are the most difficult districts. The Prime Minister doesn't call them as backward. He calls them as the aspirational districts of India. They're very, very far-flung. Say, Arunachal, we have a district called Namsai. In Assam, we have a district called Baksa. In Chhattisgarh, you have a district called Rajnandgaon. In Jharkhand, you have Garhwa. So very, very difficult districts, not merely because they are geographically far out, but because the learning outcomes and the health outcomes have been extremely poor in these districts, largely because of governance issues, not because they were not receiving resources, but because of governance issues. Here we identified about 49 indicators, and on health we have defined outcomes like, say, percentage of pregnant women receiving 4 antenatal checkups, percentage of pregnant women taking supplementary nutrition, the number of stunted children, the number of children with underweight, number of children who are wasted, the number of people who have TB and the successful rate. And what we do is that we make, firstly we've asked the states to post young officers, young dynamic officers to these districts, fill up all the posts of Asha workers, Anganwadi workers, so that we could have very good extension work. And then we use the power of real-time data collection from the field itself, so that we could rank these districts on the basis of their performance. And we rank them on a month-to-month basis and put it out in public domain. Their ranking is put out, so every district collector comes to know how he's performing in health, whether the health outcomes are improving, whether they're going up on these indicators. And there's a huge competition amongst these districts. And in the last 3 years that we've run this program, we've seen a tremendous improvement on all leading health outcomes in these districts. Tremendous performance by these districts simply because of the power of outcomes, the power of real-time data, the power of competition, the power of ranking, and the power of naming and shaming and putting it in public domain. So every officer has worked hard to improve these districts on all these major health and learning outcomes, and they've done extremely well. So this covers about 20% of India's population. If we are able to make a major dent on the health outcomes in this 20% of the population in 112 districts of India, I think we'll do a unique job for India in terms of improving our health standards overall for India. So that is on the aspirational district. It is, in the Independence Day address.
No, I was just going to say, I said I'd like to ask you a question, Amitabh, and you answered.
No, you carry
on. Please.
No, one other point. We've been talking a lot about millets, but one thing which Amitabh Bachchan asked you, which could you give us a bit more information on, is rice fortification. Millets we've done discussed a lot on, and it's crucially important.
Yeah, sure.
What is rice fortification?
Sure. Yeah. So, in his Independence Day address, the Prime Minister said that we'll universalize rice fortification. We are suffering from an intergeneration problem of anemia because of weak mothers, you have children who are wasted, who are stunted, who are underweight. And it's very, very important that we provide them with, good nutrition. And in India, about 81 crore people are given through the public distribution system. We provide them with rice. Through the midday meal system, through the integrated child development scheme, and what we call the ICDS. And in both these schemes, we provide rice. And what is very important is that you can fortify the rice with iron, with folic acid, with vitamin B12. And therefore, this becomes a very, very powerful tool to provide balanced diet. The rice by itself is not adequate. We need to provide a balanced, good quality nutritional diet, because that lack of it is the main cause of malnutrition. So the immediate task is to universalize and provide to the people of India rice which is provided through the public distribution system, which is fortified with iron, folic acid and vitamin B12.
How do you actually fortify
and therefore that will serve as a supplement. So fortification is a process which you go through the rice mills. It's an easy process. It's a task which has been tried out in several districts of India. It was tried out in Gadchiroli, in Maharashtra, and a few other districts in Odisha. And we found that this was a very, very successful program to improve nutritional standards and to break this vicious cycle of malnutrition. Because if mothers are able to get this, if children are able to get this, instead of just plain rice, fortified rice, you will be getting a huge amount of vitamin and folic acid and vitamin B12. Right. The long-term answer, the long-term solution is that while this will serve as a supplement, the long-term solution is to ensure that we are able to provide millets, which have been our traditional diets, bajra, etc., along with our public distribution system. And that is our intention, that in the immediate course, do rice fortification. In the long term, ensure that we are able to take a superfood like millets, which has been our traditional, which has been a part of our traditional food system.
Right.
And the United Nations has declared it as the year 2023 as the year of millet, to introduce it as a regular part of the public distribution system.
Excellent.